We have chosen, we Americans, to have our healthcare run as a business. It is a business. No other Western country runs it like we do.
AdvoKAYte, holding healthcare accountable. This podcast is my way of sharing what I've learned about the mistakes, the cover-ups, and the ways we can all protect ourselves. We're all in this together. Welcome to another episode of AdvoKAYte, where we hold healthcare accountable. I'm Kay Van Way, your host, and today I am thrilled to have as my guest investigative journalist and superstar in her own right, Laura Beil. Welcome, Laura.
It's good to see you.
It's good to see you as well. It's been a minute or two.
It has been.
I think when we were talking to each other over the course of the Dr. Death stories, your children were still at home, and mine were too.
Yes.
They're all now, we're almost empty nesters.
And now they're like, 20-something actual adults.
And nearly off the payroll.
And almost off the payroll.
Well, that's something to celebrate.
Yeah.
Well, we started season 1 kind of going back through some of the critical components of the Dr. Death story. And we thought it would be fitting to end season 1 by talking to you, because so much of this story would never have been known to millions of people had it not been for you.
Oh, well, I appreciate that, I was only able to tell the story because people like you talked to me, and of course the patients themselves.
Mm-hmm.
One thing about journalism that's always difficult is we always have to go back to people and ask them to relive the worst thing that has ever happened to them.
Right.
And it's really, it's difficult, and it's difficult for them. And I'm always grateful to people who are willing to, to share their experiences and relive their trauma again. And I think that shows a lot of courage, and I always have such gratitude.
Well, absolutely. And, so many of them would say, were they here today, they did it because they didn't want anybody else to get hurt like they were.
Absolutely.
Yeah.
I mean, that's the reason over and over again is they don't want it to happen to anybody else. They want accountability. Yeah. And they hope, this is almost universal with anyone who talks to me, they hope their story will have meaning and impact.
Yeah. Well, before we jump right into it, I want to talk a little bit about your career as an investigative journalist, focusing on healthcare. Mm-hmm. Can you tell us a little bit about what you did both before and after Dr. Death?
Sure. And I was never, even now, sort of, I to call myself an investigative journalist, I'm just a regular old journalist who works really hard, and but I started in doing medical reporting. I never wanted to do anything else. The short story is when I was in college, I for a long time I wanted to be a doctor, and then through a series of events, I ended up accepted into both medical school and journalism school, and had to choose, because journalism, I also loved writing and reporting, and I chose journalism because it just seemed like more fun. And but I always loved medicine. I loved science, and so I didn't want to leave that aspect of something I really like. And so, I'm really lucky. I had the best job in the world because I get to combine two things that I really like, which is medicine and journalism. And I started off in newspapers. I still have a heart for newspapers and print journalism. I spent the longest part of my career at the Dallas Morning News here in Dallas. Left and when my kids were little to freelance, and I worked a long time in magazines. I did some reporting. The only newspaper I worked for was the New York Times, and a lot of magazine career. And then one day, a few years ago, I got a call from this brand new production company called Wondery. Mm-hmm. And they were looking for a freelance journalist in the Dallas area who knew about medicine and would tell the story of Christopher Duntsch. And in Dallas, that Venn diagram is pretty small.
Right. Exactly.
So they reached out to me and said, would you like to tell the story in a podcast? And I said, maybe. I'm not really an audio journalist. And they said, well, we can, show you the audio, if
Mhm.
you want to do it. And it's interesting to me because I had done a little bit of audio before that, but the audio that I had done, there had been a producer like with me. So I just kind of did what I normally do, asking questions during research, but then the actual audio recording was done by someone else who actually knew how the recorder worked.
Mhm.
And so that's what I thought it was going to be. So I signed on to do this. And about a week later, I get an email that says, oh, here's the tracking number for the recording equipment that we're sending to your house. And that was the first realization I had that I would actually be doing the recording. And I, to this day, there are dials on the recorder that I don't know what they do. I just leave them set the way they're set. And
Right.
so if you're ever listening to any of my podcasts and the audio sounds off, that's me not knowing what I'm doing.
Well, I would say when I first met you and you interviewed me, you set your audio equipment on the conference room table at the
Yeah.
law firm, and it wasn't like some big fancy thing. It was some pretty basic.
Yeah.
It looked to me like one of those old portable
Yeah. It's
cassette
not that
players.
big. Yeah.
And
Yeah.
who would have known that from that sprang this podcast that had how many tens of millions of downloads?
I don't know, actually. The last I heard a few years ago was 70 million, but
It's crazy.
I don't know what it is now.
Eh,
I don't get those numbers.
The other thing that I would say is that you talk about, well, the audio may not be all that great or whatever, but I think we could probably get 1,000 people in a room and have them close their eyes and play your voice, and your voice would be recognizable to a large number
maybe.
of those people. Very much so.
Yeah. Wow. Well, I feel very fortunate to have been able to, it wasn't a story I was looking for, and to have been able to tell this story in a way that was really impactful and reached a lot of people. I do want to say, though, my work that I did on the podcast was on the shoulders of good local reporting that had already been done on this story. There had already been really great stories from, Texas Observer, from Brett Shipp at WFAA, the Dallas Morning News, and of course the big D Magazine cover story where
Yeah.
they called him Dr. Death, and all of that had already taken place before I did the story. And so I just want to credit them, like, for getting this out there, for breaking this story. And then what I did was take it a step further, because the podcast is really not the story of Christopher Duntsch. It's really not.
Mhm.
It is the story of our healthcare system. And that is really the major character in the story, because he could not have done the damage he did. And no bad doctor can do the damage they do without the complicity of the institutions that are supposed to safeguard against this. And so that's really the story that I was looking into, is, yes, his story, but also how did this happen? So, as one of my producers said, it was listed as true crime, but it really wasn't a whodunit, it was a whydunit.
Oh, I love that.
And
1,000% on the system that gave us Christopher Duntsch, the system that perpetuated Christopher Duntsch, and the system that didn't change significantly as a result of Christopher Duntsch.
yes, that
And
way.
I've told this story before, but when I go to speak to audiences about the case, I start off telling a story about a drug-addicted spine surgeon and all of the failed drug tests, and how he kept going back into the operating room, kept being allowed back in. And I will say to the audience, does anybody know who I'm talking about? And they'll be like, well, duh, I mean, you're Christopher Duntsch. I'll be like, no, that was 10 years before Christopher Duntsch.
Yeah.
And then you could tell, and I could tell, and many others could tell, many harrowing stories of things that have happened since Christopher Duntsch.
Yeah, there's a reason there's 5 seasons. No. Or
Right.
there's about to be 5 seasons.
Yeah.
Yeah. No, it's true. I think one of the most impactful moments for me working on this story is when I was talking with Dr. Robert Henderson, who was one of the doctors, of course, who was trying to stop this from happening. And I was interviewing him, and I asked the question, this is in the podcast, what's changed as a result of all this? Do you think things have changed now where this could happen again? I forgot the exact wording of the question, but it was like that. And there's this long pause. And he's like, no.
Right.
And
Right.
that was a very telling and truthful moment.
It reminds me a little bit of, what has changed in the 12 years, I guess it's been since the cases occurred, 12 or
Yeah.
13. But something that I've noticed is that it used to be the patients, the plaintiffs' lawyers, the patient safety advocates versus the healthcare system. And now it's the patients, the patient safety advocates, the plaintiffs' lawyers, doctors, and nurses versus the system. Because if you want to talk to somebody who's really upset about the problems that we have with our healthcare institutions, talk to the doctors and nurses these days. They're just getting squeezed
Yeah.
from all directions. And these are, unlike a Christopher Duntsch who was dangerous and should not have been practicing, nowadays there's good people and good doctors and good nurses who are getting broken by the system, and they're making errors that hurt people as a result.
Yeah. Yeah.
So,
Well, it comes down to, in my opinion, it's money. It's about money. Healthcare is a business.
yeah.
And the common thread in these stories, and all the stories I do about system failures in the healthcare system, is, it comes down to money. When you start making decisions that are based on the financial repercussions rather than patient safety, that's when you start down a path
Yeah.
that is bad. And that's like the common thing I see is money and greed. And that then that's the framework that allows all of this other, stuff to happen. You can kid yourself and say, oh, it's not that bad. Or you can turn a blind eye. You can do a lot of rationalization. Or commonly you can just solve your problem by making it someone else's problem, because you don't want to deal with the money and the paperwork that it would take and the hassle to solve the
Yeah.
problem. I think.
Yeah.
I don't know. What do you think?
No, I totally agree. And, I think I told you this before, but maybe 15 years before the Dr. Duntsch cases, I was heavily involved in this pill mill litigation where people would go, they didn't even have to be doctors originally. Somebody would go open a pain clinic in a strip shopping center, and then they would get a doctor or sometimes a physician's assistant, nurse practitioner to come in. You come in, my back's hurting today, what would you like? And they would just write gobs of these pills. But Dan Rather is from around Beaumont, Texas. And
Yes.
there was a big case down there. A 25-year-old young man accidentally overdosed after going to one of these places. Dan Rather came down to do the story. And it was the thrill of a lifetime for me to get to meet Dan Rather. The point being, he said to me, well, what do you think this case is all about or whatever? And, I don't remember what my answer was, but he said, the thing I learned as a cub reporter is always follow the money.
Yes.
And
Yes.
that was a kind of a long story of me getting to the punchline, but I never forgot that because it's the way we approach our cases in the law firm is it's always the system, and almost always the system issue is because of a money issue. And that's
And greed, don't underestimate greed. And even, yeah, I mean, that's what it comes down to. And patients are the last to know. And I think the other problem with the system is it's so hard for patients to even know this.
yeah.
Like in the Dr. Death case, in Christopher Duntsch, like the last patient he had, Jeff Gladwell thought he was doing all the research that he needed to, and he did. Like, he did all the research that was available to him. And there are doctors I know of that are terrible because people call me and tell me about this, but officially the patients can know nothing.
Right.
And I understand that you do want to make it hard to tarnish the reputation of a doctor, to report a doctor. Like, these are very serious issues, and you're talking about a doctor's livelihood. So it should not be easy to say, to complain about a doctor and have that affect their reputation. And I understand that and appreciate that. It should also not be so hard, and
Right.
I don't know what the solution to that is, but it always amazes me that as patients, when we're trying to find out about our doctors, like, I can find out more about a new refrigerator that I want to buy than I can about a doctor. And so you're
Yes.
left a lot of times using this kind of, like, you're making a restaurant reservation. Like, what are the reviews? What do people say? And that's what
Yes.
we are left with. And unfortunately, with those reviews, you can manipulate those to, to make them sound better than it is. So you're really left with, almost nothing except
Right.
word of mouth and your own spidey sense,
Exactly.
about a doctor. And
Yep.
I'll tell you a story about and I would say to people, if you do have a bad feeling, don't
Mhm.
dismiss that,
Mhm.
because my own mother, she passed in 2020, unfortunately, but before that, she had back issues. She had back surgery, so it was in East Texas, and so she wouldn't have surgery. So of course, my antenna's up, and I'm like,
Mhm.
"Okay, Mom, I want to go with you to this." She's like, "I met this doctor. She liked him." I said, "Next time you go, I want to go with you to the
Mhm.
appointment." So I go to the appointment with her, and I didn't like him. I did not like him. I was asking questions. He was dismissive. I would say, "Well, why does she need this surgery? What exactly are you going to do?" And my questions were not only not addressed, but they were seen as, "Why are you asking me this?" And I didn't like it. Had a
Mhm.
bad feeling. Tried to talk her out of the surgery. But one thing about my mother is when she got something in her head, it was really hard to get out. She had the surgery. She was in pain for the rest of her life. She had been in pain before, and it actually, I think, made the pain worse.
Mhm.
And she, so that is what happened to my mother. Last month, the story broke that doctor, being investigated by the medical board, has a chain of patients that he'd harmed. Like, everything that I feared about him, is true.
Right. Right.
It just
Yeah.
took a while for it to come out. And so my point is, if you just get a bad vibe,
Yeah.
that's fine. You need to follow up on that. And maybe you're wrong, but that's what we have to go on sometimes,
Yep.
is vibes.
Get a second opinion.
Get a second opinion.
Always. And if you're not happy, get a third opinion. But we try to not scare people, because that's not
Right.
what this is about.
No.
But if it can happen to Laura Beil's mother, it can happen to anybody's mother.
Yeah.
But the other thing I was going to comment there is that it's not as if the information is not unobtainable. It's there. It's just secret. By law,
Yes.
it is secret.
Yes.
And part of why I'm doing this podcast is to try to get a movement of people who can then pressure politicians to pass laws and change things.
Yes.
And that may be a lofty goal for one little old lady at this stage of her life, but we've got to start talking about these issues. So let's say, for example, that you're wanting to compare surgeons. And let's say your insurance company even says, we will only approve these 5 doctors at these 2 hospitals. Well, there is getting to be some better information about hospitals through the Leapfrog Institute, and they have their hospital grades, and we're going to have them on in a later podcast. But for doctors, it's still pretty nothing out there and hard to distinguish what's a paid, like a glam thing, versus what's real. but the hospitals know.
They do.
So the hospitals know, let's say for an infection rate, the hospitals know what the national average of an infection rate is for a lumbar laminectomy, for example. Then they would know also, okay, we have 10 spine surgeons at this facility performing lumbar laminectomies, and these doctors are above the national average, these are below. And then they track things like which doctors have more postoperative complications than others, which doctors have to return their patients to the OR for additional surgery and more than others. I mean, I don't think we're doing anything bad to doctors just to say, look, if you're
No.
a great doctor, put it out there.
The vast majority of doctors, as you know, like 99% of doctors are good people who want to do right by their patients. The issue is if you get that 1%, it's horrible.
Yep.
And
right.
somebody should be stopping, that doctor. But yeah, most doctors are good people who went into the profession for the right reasons and want to take care of their patients. And you see the most horrible doctors. You see worse than I do. And I think you would agree with that.
Yes. And I don't know if the number's closer to 20%, but there's some studies on that, and there are some
Yeah.
commonalities against about the doctors who have the most claims.
Yeah.
And the bottom percentile, whatever number that is, have lots of claims, not just. And I tell doctors this all the time, that fear lawyers, they fear medical malpractice lawsuits. And, we heard that for so many years. Oh, doctors are practicing defensive medicine. And I'm like, well, somebody needs to get the word out that they don't have anything to worry about. The law of medical malpractice they've tried to legislate us out of existence.
Yes.
So, lawyers like us, we're only able to take about 1% of the cases that come our way. So, well, it's really interesting. I know I'm jumping around a little bit here, but so many things to talk about. But talking about transparency, you or I would tell a lot of people, oh, well, go check out your doctor on the Texas Medical Board website. And there's a young journalist down in Austin by the name of Matt Grant, and he's with KXAN.
Yes.
Do you know Matt?
I do know Matt. He's very good.
And he did this, and this is why investigative journalism is so important. He did a deep, deep, deep dive into the medical board was not enrolled in continuous query with the National Practitioner Data Bank, meaning although the information was available, if a Texas licensed doctor or a doctor applying to become licensed in Texas had a report to the data bank from another state or a hospital or a medical malpractice insurance carrier, they may or may not check on it. They were letting doctors go on the honor system. And so Matt found all of these crazy instances where doctors had horrible backgrounds.
In other states.
Yeah. And so as a result of that, a law was passed requiring now the Texas Medical Board to enroll in continuous query, meaning instead of relying on the honor system or relying on the medical board to do a query, that the information is getting pushed to them automatically. And, one of their excuses was, well, we can't afford that. And, the answer was, well, tack it onto the doctor's licensing fee. And I don't remember, I think it was about $8 a year. So here's another example of information that the public should have, but the institutions that we rely upon to protect us patients drop the ball. Medical board drops the balls. Hospitals protect doctors over patients by not reporting to the data bank, and so on and so forth. So
and that was great reporting, and I'm glad that, another thing that I would like to see is, because I worry about the doctors who are just terrible and killing people. But I also worry about the doctors who are just kind of bad, you know, and there's no mechanism for that if the discipline. But one thing that is a red flag to me when I'm looking at someone or working on a story, it's a doctor who keeps moving. Like, why did you live in 3 states in the last 15 years, you know? And you know, that what does that signal? Maybe you move around a lot, but it could be that you were trying to escape and reinvent yourself in these places. And maybe there weren't like serious complaints against you, but you were bad. So what I would like as a patient is you can see not only was there disciplinary action, but where else has this doctor lived? How often did he move? He was licensed here and this thing here and here, you know, this date on this date, this date on this date, this date on this date. Because then you can see like, well, why? This is a doctor who moves around a lot. Like maybe I should ask more questions. There could be a legitimate reason, but there might not be. That seems like information that would not be hard to share.
Right, exactly. Yeah,
Yeah.
it's like a job hopper for a
Yes.
job application. You're like, well,
Yeah.
they could have run into a series of bad employers
Yes.
and they only lasted 6 months or a year or whatever, but more likely than not, the pattern is because of them.
Yeah. So
Right.
I don't know. This is basic information that I wish that we had as patients because the burden is on us. And yes, to your point, in states like Texas, you know, malpractice cases are an indicator of almost nothing because like a story I'm working on now, you know, the people didn't sue because of the malpractice laws, or one person said, you know, my baby died. I was not going to have anyone tell me that my son was only worth $250,000,
Right.
you know, and so it discourages patients. I mean, we had the case of even you know, and it can happen to anyone. It happened to my mother, Congresswoman Eddie Bernice Johnson. Look at
Right.
what happened to her,
Yes.
you know, and, you know, terrible case. It didn't, and she's like, was a sitting, well-known member of Congress,
Right.
you know?
No one is exempt. And, you know, the accountability piece is challenging because not everyone who has been harmed by a preventable medical error has access to the legal system because the rich and powerful have shut that down.
Yes.
Not completely, but the prevention piece also has to be a priority.
Yes.
And it's going to take everybody. And I have struggled with this too because it's like we don't want to be fear mongers and say, everybody better get behind this movement because you could be next.
Right.
But every one of us is a patient. All these politicians are patients. 100% of their constituents are patients. And, you know, I don't think I came up with this originally. I think it was perhaps Marty McCary, Dr. Marty McCary, who came up with this. But, you know, if airplanes were falling out of the sky and killing everyone on board, people wouldn't fly. They'd take the bus or the train, or they wouldn't go on vacation.
Right.
We have a choice about whether to get on an airplane. We don't normally have a choice about whether to access health care.
No. Or who you get,
Yes.
you know, or who, yeah. I mean, it's a privilege if you're able to, you know, have a lot of choice in who you go to. You know, because of the, you know, especially in Texas, because we have such a high rate of people without insurance.
Yeah.
And, but yeah, no, these are all things I worry about. But to the fear mongering question, yes, I do think that we're not talking about most doctors, most nurses, most patients, you know. It's just the system makes it hard to find the ones that you need to be cautious of.
There's, I was recently talking to a joint replacement surgeon, and I don't remember how the topic came up, but he said to me, 20% of the surgeons are excellent. And those those doctors tend to know who the other 20% are, and they tend to refer to one another. And then there's the 20% at the bottom that are horrible, dangerous, bottom of the funnel type doctors, And they tend to know each other. They tend to run in the same circles and they tend to refer to each other. So then that leaves us with the other 60%. And we don't just dwell in the bottom 20%. There's doctors and nurses within the 60% who are not everyday dangerous doctors. They're not bad people necessarily, but oftentimes they either started out good and they just got broken down by overwork, moral injury, just burned out, or um, the system has so many flaws in it that there was a communication lapse or there was a charting issue. And so, there's all kinds of reasons that mistakes are made.
Yeah.
But I'm going to have a guest on from Mount Sinai Hospital in a few weeks who is studying the science of human factors engineering, and they know how to prevent a lot of these system failures that.
And don't you think a lot of the burden for that is on the people who run the hospitals and who run, like, to make things better for your doctors and therefore for your patients? I mean,
Yes.
and a lot of times you have to invest in this, and it costs money to prevent these things
Yes.
from happening. And so I think in that case, the burden's not on the doctors. It's on, I mean, it is, but it's on the administrators and people who create the conditions under which doctors work.
Yes. And administrators are the same way. There's some good and kind-hearted people working as hospital
Yes.
administrators, and there's some with what was the Grinch, the teeny tiny little black heart.
Yes.
But it's a very complex topic because it all depends. Is corporate headquarters, a bean counter up there figured out that if you could squeeze out, if you could cut the turnover time in the operating room by on an average of 7 minutes per case, then they could do 3 extra cases a day.
Yeah.
And then that would result in X number more dollars. Or
Yep.
if you've got a hedge fund owner who says, we know what safe nurse staffing levels are because this is all mandated, but we're going to short staff. And then when the nurses get to the point where they're about to all balk and run out the door, they say, well, just throw them a pizza party and see if you can make them happy.
Yeah.
And so there's just 1,000 things that go on
And
behind
you
the
have
scenes.
people who are making the decisions who are removed, who are this many layers removed from patients. Like you mentioned, hedge funds. I mean, this has been a big issue, I know, in long-term care facilities. That you have these funds buying up long-term care facilities to try to basically squeeze them for money.
Yeah.
And I think I I think there've been studies that show like what happens to the care when it's, when your facility's bought by an investor who just wants to, have a return on their profit. And
Yeah.
I mean, yeah, this is U.S. healthcare. We have chosen, we Americans, to have our healthcare run as a business. It is a business. No other Western country runs it like we do, and this is our choice. We want healthcare to be a business, and so decisions are made based on what's good for business at the end of the day.
Yeah.
I think.
Well, that's right. And, I guess I say, God bless us all. And we hope that there's good people on the inside fighting for what's right.
Yes.
And we know that there are.
And there are. And there are good people who want to do good, and administrators who want to do good, other doctors who want to do good, nurses who want to do good.
Yeah.
And that's, we have to have our faith in those people.
Yeah. And those people, those doctors and nurses in particular who went into healthcare because they were and are good-hearted people that want to help people, I really hope that they'll find their voice and that they'll stand up and just say, we're not going to be, we're not going to let the system be this way.
Yeah. And they have to have, it takes a lot of courage. So I can't talk about it, the details, but I'm working on a story now about a powerful doctor who has a lot of money and influence in one particular community. And there are doctors and nurses who know this is going on and want to speak up, but they are afraid. They are afraid. And it's been a really difficult story to report because of the fear.
Mm-hmm.
And I understand the fear. And there are those who are speaking with me, and I respect them so much, and I respect their courage so much, because it is hard, because they're afraid if they speak up that this doctor will sue them, which was an issue with Duntsch too, why he kept getting referrals. They were afraid he would sue them. And I think you even said in the podcast, I believe this was one piece of insight, that doctors are more afraid of being sued by other doctors for speaking up than they fear their patients.
Mm-hmm.
Weren't you the one that said
that? May have been Dr. Henderson.
Oh, maybe somebody said that.
Well,
but
let's just give him the credit, because he's such a great
he is
guy.
a great guy.
Well, I thought you were talking about a case I have going on right now, but I know you're not.
No.
And I have that identical thing. And there's actually someone who got this doctor on tape, getting in the faces of the nurses and the other people, say, "I'll hunt you down.
Yeah.
I'll ruin you.
Yes.
You cannot say one cross word about me, even if it is
Yeah.
to save your own patients." So
Yeah.
it's a thing.
Well, in the case I'm working in as an attorney, you'll appreciate it. There is one attorney involved who put a ad, as attorneys do, were you treated by this doctor? Call me, trying to find other patients. And the doctor sued the attorney in this case for defamation, for putting the ad.
Well, we need to start a club of of lawyers who have been sued by doctors for defamation.
Really?
Yes.
I'm
in that club.
Oh,
Yes, yes,
wow.
yes, yes.
Well,
Yeah.
good for you for persevering in that.
Well,
It's a real fear.
What I
It's a
say,
real
truth
fear.
is an absolute defense to
Yes.
slander.
Yes.
So let's hash that out.
Yes.
Right.
Yes. No. But it's an intimidation tactic, as you are well aware,
Mhm.
and it works.
It does. And it works against other doctors too.
Yes.
So, well, maybe you'll come back when your news story breaks and we can talk
Sure.
about that. But
Yeah.
so
And I can plug that. I can't talk about the details, but there is season 5 of Dr. Death. It will be out in June.
okay.
And I
Wonderful.
can't talk about the details yet, but it does involve another neurosurgeon.
Oh, I can't wait
Yeah.
for that.
So tune in June.
I'm so glad that you're still hard at it and doing your
Yeah.
great journalism. And I know that your journalism has saved lives and has saved people from getting drawn into some of these healthcare schemes and frauds and all kinds of different things.
Well, we all, you as an attorney, doctors, we all go into our jobs, I think, to make a difference. And we all make a difference in our own way with our own, skills and talents and passions.
Well, it's my little dent in the universe is certainly much smaller than yours and other people's. But I say if we're all making a little dent, maybe all those little dents can
Make
rise
change.
up to make a big difference. So,
Yeah.
we'll die trying, I guess. But so good to see you
It's
again.
been a pleasure.
Yeah.
It's been a real pleasure.
Thanks for joining.
Of course.